Think those shiny razor-sharp teeth are just for show? Think again. Piranhas are one of the most feared freshwater predators. And yes, they can bite. But how often do they attack? And what should you do if you find yourself in their jaws? Let's dive in. Every year, there are over 100 reported piranha attacks worldwide. But actual numbers might be higher. Many bites go unreported. Most incidents happen in South America, especially in Brazil's Amazon basin and the Pantanal wetlands, where piranhas naturally thrive. So what draws these fish to humans? Sharp movements, splashing, or just wading too close to their territory? Here's what not to do to avoid an attack. Don't thrash or splash wildly. It attracts attention. Avoid swimming near riverbanks or in murky waters where visibility is low. And never provoke or feed wild piranhas. It makes them more aggressive. To stay safe, stick to designated swimming areas, stay calm if you see piranhas, and avoid wearing shiny jewelry that might catch their attention. Got bitten? Stay calm. Rinse the wound immediately with clean water to reduce the risk of infection. Apply pressure to stop bleeding and seek medical attention as soon as possible. Antibiotics may be necessary, and in some cases, a tetanus shot or rabies vaccination might be recommended. Remember, piranha attacks are rare, and most fish just want to be left alone. Respect their habitat, stay cautious, and you'll be fine. Got questions or stories about piranhas? Drop a comment below and tell us, what should we cover next? Hit that subscribe button and let us know.